Hello everyone. In this video, we are going to study about renal stones. It is a topic from surgery, right? First of all, we will discuss everything about stones one by one. There are different types of stone. So starting with calcium oxalate stone. It is the most common type of renal stone. The most common type of renal stone is actually calcium oxalate stone. So is it radio opaque or radiolucent? Very important thing that it is radio opaque. What do you mean by radio opaque? We mean that it can be seen on X-ray, right? And radiolucent means it cannot be seen on X-ray, right? Then calcium oxalate stone is generally found in acidic urine. Calcium oxalate stone is generally found in acidic urine. Most of these stones are found in acidic urine only, with one exception I will tell you later. There are two types of calcium oxalate stones. First one is monohydrate type and the second one is dihydrate type. Calcium monohydrate stone and calcium oxalate dihydrate stone. So what is the morphology or the shape of these type of stones? First, the calcium oxalate monohydrate stone is dumbbell shaped, right? Is dumbbell shaped, and the calcium oxalate dihydrate stone is envelope shaped, So dumbbell looks like this and envelope looks like this, right? So how to remember? See, M monohydrate, M dumbbell, right? Don't confuse that dihydrate and D, right? Dumbbell M is between and M for monohydrate. So in this way you can remember, right? It is very important to remember these two shapes. You can confuse between these two. Here is the photo of calcium oxalate stone. See, calcium oxalate monohydrate is dumbbell shaped and the calcium oxalate dihydrate is envelope shaped, right? Very easy to identify. Calcium oxalate stone precipitates with, now calcium oxalate stone generally precipitates with acidic urine, right? Or hypocitraturia, or hypocitraturia, acidic urine or hypocitraturia, right? It can result from Crohn's disease. Then it can also result from acidic urine, PEG ingestion, polyethylene glycol ingestion, right? So these are the few things that can result in calcium oxalate stone. Apart from acidic urine, I should have written over here, vitamin C excess can also cause hypocitraturia. What is the treatment of calcium oxalate stone? The treatment is decrease fat ingestion, right? Increase calcium intake in diet, right? It may be surprising to you because calcium is a component of the calcium oxalate stone, but still we have to increase the calcium in the diet. Now there is a reason behind it. I personally think that you don't need to know why is it so, but still remember that increase calcium in the diet, but decrease salts in diet. So decrease salts or sodium in diet, right? So this is the way question can be asked, right? Calcium should increase and salt should be decreased in diet, right? So that's it guys, we have done calcium oxalate stone. Now coming to calcium ammonium magnesium phosphate stone. Calcium ammonium magnesium phosphate stone, there are three components and then phosphate, so it is also called triple phosphate, right? And the other name is struvite stone. Okay, now is it radio opaque or radiolucent? Again, it is radio opaque, which means that we can see it on X-ray. Where does it form? It forms in alkaline urine. Now this is the place where you will get alkaline urine. Rest all it is acidic urine. Okay. Infection is generally seen with urease positive organism, right? It is generally seen with urease positive organism. Extremely important. For example, Staph saprophyticus, then Proteus species, right? Proteus species is famous for forming struvite stone, and then H. pylori. So these are the examples where you can see struvite stone. So here you can see in that X-ray, this particular image, this is the right side and this is the left side. So this is right-sided struvite stone, or we also call it as staghorn calculi. Very important, right? This particular photo can be given in your examination. Then what is the shape? It is coffin shaped, right? Coffin shaped. We all know what a coffin is. Okay, so it is coffin shaped. It looks like this. Coffin looks like this, right? So this is the shape of struvite stone. Extremely important. What is the treatment of recurrent struvite stone? It is very easy. It is acetohydroxamic acid, right? Acetohydroxamic acid, acetohydroxamic acid, right? Generally not asked in examination. Next, cysteine stones. Cysteine stones are again radio opaque. Cysteine stones are radio opaque. Where does it form? Already told, there is only one alkaline, rest are acidic, so it forms in acidic urine. Very hard stone. Extremely important for you to know that it is very hard stone. It is so hard that it is a contraindication for extracorporeal shockwave lithotripsy, right? It is a method of management of stones. Shock waves are given and the stone breaks down in the tract, right? And the broken stone parts come out of urine. So ESWL cannot produce so much waves so as to break cysteine stones because they are very hard, right? It is seen in cystinuria. And treatment for recurrent cysteine stones, what is the treatment? It is D-penicillamine. It is D-penicillamine. It is D-penicillamine. Now what is the shape of the stone? It is very easy. You can remember it in this way: cysteine stone, right? Or 16 stones. Cysteine stone or 16 stones, right? Six means 6 sides, right? So this is a structure with 6 sides, right? 1 2 3 4 5. It is hexagonal in shape. Hexagonal in shape. Cysteine stones are hexagonal in shape, right? So it is very easy and you can remember it, and you have to remember it. Next, coming to uric acid stone. Now this is the first place where you will see radiolucent stones. This is the first place where you will see radiolucent stones. Means you won't be able to see it in X-ray. And already told, everyone is acidic except struvite. Struvite is alkaline. So again, uric acid stone will be acidic. Crystal resembles glass shards, like, okay, glass shard appearance. The crystals will be like glass shards, like broken glass. See over here, this is the shape. This is called glass shard. Glass shard, right? Seen in uric acid stone. Seen in uric acid stone. Okay, so where you will generally see this type of uric acid stone, wherever uric acid will increase. When does uric acid increase in our body? In gout. And next one is tumor lysis syndrome. Why does uric acid increase in tumor lysis syndrome? Because tumor are formed of cells. And what does cells contain? Cells contain nucleic acid, nucleus. And in nucleus they contain DNA, RNA, and DNA, RNA are nothing but nucleic acid. So when nucleic acid break down, the end product is uric acid. That's why tumor lysis syndrome causes more uric acid, and hence uric acid stone can form. And there are a few other types of rare stones: xanthine stones, right? Triamterene stones, indinavir stones. So once INICET has asked that which of the following drugs can cause stone, and indinavir was in that option. So you have to remember triamterene, indinavir also. Also remember, in IBD and laxative abuse, ammonium urate stones are seen. What is the clinical feature? Most of the time it is asymptomatic, but most common symptom is pain, right? The most common symptom is pain. So if pain occurs, pain generally occur at the renal angle, right? Pain generally occur at the renal angle, or pain can be colicky also. Colicky pain, you all must have been knowing, you must have heard it in practical in 4th year, colicky pain. So if the colicky pain is present in pelvis, if the stone is present in the pelvis part, so it will cause loin to groin pain. Loin to groin pain. It will cause loin to groin pain, right? If the stone is impacted in the upper ureter part, it will stimulate the obturator nerve and will cause pain in inner thigh pain. If the stone is impacted in the mid ureter, it will cause irritation of iliohypogastric nerve. And if it is in the lower ureter, it will cause irritation of the ilioinguinal nerve. Not irritation, I should say. It will cause referred pain through ilioinguinal nerve, right? Not very important, but is important. Intramural, if the stone is impacted in the intramural part of the bladder, it will cause strangury. Now it is very important to know strangury, right? What is strangury? Strangury is whenever you will feel like passing urine, you won't be able to pass urine. Instead of urine, 1 to 2 drops of blood will come. This is actually definition of strangury. Other symptoms of stone are hematuria, hydronephrosis, and Diethel's crisis. What is Diethel's crisis? Diethel's crisis, see, this is kidney and this is the stone. For example, this stone which is impacted over here comes down over here. Now suddenly what will happen? This enlarged kidney will now shrink in size and lot of urine will come out. You will pass a lot of urine, right? This is called Diethel's crisis. Got it? So it is very easy, nothing hard. What is the investigation of choice of renal stones? It is very important. NCCT. It is so important that almost every time, almost every alternate year, a question can be asked from this particular thing. What is the investigation of choice for renal stone? It is surprising, but it is NCCT. What is the management? How will you manage a renal stone? Right. The management of renal stone is, if the stone is less than 5 to 6 millimeter, then you will observe. observe because the patient will spontaneously pass. Or if it is more than 5 to 6 millimeter, or if it is symptomatic irrespective of any size, what will be the first line treatment? The first line treatment will be extracorporeal shock wave lithotripsy. So what are the contraindications of extracorporeal shock wave lithotripsy? We already discussed that. No, we already discussed what is ESWL. So what are the contraindications? You cannot give shock waves in pregnancy, in uncontrolled bleeding disorders, if the patient is having cardiac pacemaker, if the stone size is more than 1.5 centimeter, if it is a child, obese, very hard stone, for example, Cysteine stones, right? Very important. In Cysteine stone, ESW is contraindicated, already discussed. Obstructed systems, right? If the system is obstructed, your renal system is obstructed, even if you break the stone, where will the stone go? Because it is obstructed, it will again accumulate at the obstructed site. That's why you don't do that ESWL over there. In lower calyx stone, because in lower calyx stones, for example, the stone is present here, this is kidney and stone is present here, you break the stone, but how will the stone come out from here to here, right? Because of gravity, it won't be able to come out. That's why in lower calyx stone, you won't do ESWL. For example, if ESWL is contraindicated, what will you do? Percutaneous nephrolithotomy or retrograde intrarenal system, for example, Dormia or laser. What laser do we use? Holmium yak. So what is the summary of treatment? The summary of treatment is, first you will do extracorporeal shock wave lithotripsy. If it is contraindicated, then you will go for PCNL, percutaneous nephrolithotomy, or RITS, right? Or RITS. If both fail, then what will you do? You will do pyelolithotomy or nephrolithotomy. Pyelolithotomy or nephrolithotomy or urosurgery, and we do these to remove stones directly from the site where it is present. Now coming to bladder stone, very easy topic. I want to complete it in 30 seconds. It can be primary or secondary. Primary when it is due to no cause we know. For example, it is not infected. Secondary due to infection. These stones have formed, that is called secondary. Most common type of bladder stone is mixed urate stone. Very important, not uric acid stone. What is the investigation of choice? Again, NCCT. And what is the management? Of first line management of bladder stone? It is perurethral removal, which means perurethral removal of stone, or cystolithotomy, which means that you will go through urethra and take the stone out, right? Lastly, I want to discuss in NCCT's investigation of choice for what things? Silolithiasis, stone of the salivary gland and its duct, renal stones already discussed here, and head trauma. You all must not be knowing it. So that's it, guys. We have completed this big topic. Everything is important, especially the shapes, radio opacities, and acidic urine or not, right? These things are most important.